Hello to everyone. I am Sevi, the IVF coordinator at EmBIO Clinic. Today's topic is donor egg IVF, a treatment option that helps individuals and couples build a family when using their own eggs is not possible or not the best option. Today, our goal is to explain who donor egg IVF is for, how to process how the process works step by step, safety, success factors, and what affect emotionally and practically. What is donor? We will say what is donor egg IVF, who is donor egg IVF for, what drives the outcomes, safety and quality, recipient preparation, donor preparation as well. So let me see, where is the presentation here? One moment. Great. So we have the presentation here. We can see it together. Okay. So step one is the consultation with Dr. Thanos Paraskos. Patient ask the question, expectation, family with doctor, they receive a full evaluation and plan, and then you choose how you want to move on with a video call, phone call, or in-person meeting. You can come also in Greece for one day, meet us, do the evaluation, see our premises, team. Now, I would like to say something. What is donor IVF? I know what it is, but we will go through some topics here. So, donor IVF is an IVF treatment where eggs are provided by the eggs are fertilized in the lab with the sperm from or from a donor sperm. The resulting embryos are to recipient uterus, and the recipient carries the pregnancy and gives birth. Okay, let me change that. Okay. Who is donor egg IVF for? Common medical reasons that we face. Women have low ovarian reserve, poor egg quality, repeated IVF cycles with poor embryo development, premature ovarian insufficiency or early menopause. When we have advanced, where egg quality is the limiting factor. In Greece, the age limit is 54 as per legislation. Also, genetic condition where using own eggs would carry significant risk, or prior ovarian surgery, chemotherapy, it's the ovarian function. Okay, so what we do as a coordinator, what we do. So we will accompany you through every step of the process. You after doctor's review first, okay, your medical history, all required blood tests and screening needed, which can be completed or in your home country before embryo transfer, or you can do it in Athens as well. As I told you, you can come prior to that for one day in Greece. We can explain detail for your treatment plans, costs, payment options, all packages that we have. And also we can help you with your fertility trip to Athens. Depending on your medical plan, you can come in 2 to 7 days and enjoy your vacation as well, and also the your IVF. Okay, in that point, I would like to say the outcomes from donor IVF, the success rate. To what is success rate linked? Linked to the donor age and egg quality, sperm quality, of course, embryo development in the lab, uterine readiness, and overall health of the recipient. And as you know, donor eggs can significantly improve chances when egg quality is the primary barrier. We should also mention the donor screening at EmBIO, and the quality. So every donor, in order to be eligible in Greece, must do some medical screening. Okay, it's the typical clinic standard as per legislation. So a detailed medical history and family, they are screened for that. Infectious disease testing, also gynecological assessment and ovarian reserve evaluation. Also genetic screening, carrier screening based on guidelines, psychological and suitability assessment, ensuring informed donation and readiness, and also practical matching considerations like blood group, physical characteristics, ethnicity, basic phenotype matching, and donor availability and program rules. Okay, so the selecting of your egg donor, how it's done. We have a large pool of young and healthy donors. The age in Greece is from 18 till 30 years old. Our pool is about 170 young women. We have a wide variety of ethnic backgrounds and physical traits to match with your preferences. You will, when you are ready for that step, you have to donor request profile. You will send it back to us. Our egg donation department will do the match according to your criteria and also what we have available, and that will be sent to you in 1 or 2 weeks approximately, according to what we have available that specific time for you. Okay, so I can refer here the recipient, what is, okay. So the core here to prepare the endometrium, okay, the lining, so it can be receptive for the embryo implantation. So some typical steps are the baseline ultrasound and hormone blood test, tailor-made medication plan, often with estrogen and progesterone, or a natural cycle approach when it's suitable. This is okay. We have to review that, and also endometrial monitoring, thickness and pattern and timing confirmation. Also, checks if that it's indicated, it's uterine cavity assessment, either with a hysteroscopy or a sonohysterogram. When history suggests that fibroids or polyps or we have adhesions, okay? Also, we check thyroid, prolactin, vitamin screening, thrombophilia evaluation, only when it's indicated. So since I said about the recipient, now I can refer to you the donor egg IVF process step by step, what the donor does. So step is the stimulation and the egg retrieval. Donor uses injections to grow multiple follicles. Eggs are collected under sedation with ultrasound, fertilization in the lab. Eggs are inseminated with sperm or fertilized via ICSI, common used in IVF. Embryo development, culture and development. Embryos are monitored until day 3 or 5 or 6 blastocyst stage. We have optional embryo genetic testing, the PGT-A and the PGT-M. This is discussed based on age, history, losses, repeated failures, or if we have any genetics, some life mutations reported. Embryo transfer, carefully timed ultrasound guided procedure. It's single embryo transfer is often recommended recommended to reduce multiple pregnancies if that's the case. Then we have the luteal support and pregnancy tests. You continue progesterone and estrogen as instructed. Then blood pregnancy test typically is about 9 to 12 days after the transfer. So that's it overall for how the two preparations are done for both sides. Okay, so I can explain also frozen transfer at this stage. So usually we do fresh transfer. We try to synchronize the recipient and the cycle. So with fresh transfer happens in the same cycle as the fertilization. We align the timing precisely. If we want to do embryo frozen transfer, so embryos are frozen and transferred in a later stage. That's more controlled cycle if that's indicated, because that offers flexible timing, more controlled uterine preparation plan. The rate is same with fresh and frozen. There's no problem. What to expect from the recipient side? Most recipients experience minimal discomfort from monitoring, ultrasound, and blood tests. Medication side effects like mild bloating, breast tenderness, mood changes, fatigue. From embryo transfer day, usually is quick. No anesthesia is required, otherwise, for some medical reasons, which the recipient will share with beforehand. And then she can return to normal daily activities. Is done very, very, very quickly. About the emotional aspects, so common feelings that is relief, hope, grief, not using own eggs, anxiety about outcomes. So what we do a clear counseling and communication before decisions, coordination and consistent communication, so patients feel guided and not overwhelmed about this procedure. How we can reduce that from recipient, the pregnancies depend on recipient hyperstation or any gestational diabetes. The risks are very minimal because they are managed with modern protocols. They are not hyperstimulated, and the retrieval procedure risks are none. Okay, so our approach is individualized. We have individuals, strong standards, emphasis on embryo transfer, 2 embryo transfers per cycle when that is appropriate according to age and legislation. Okay, so one moment. We can say now about the typical timeline overview. This is something we should consider. Typical phase is the evaluation and planning, okay, medical review, test, and counseling. Donor selection and scheduling, that depends on the availability. It usually is after from the request from the recipient. So we are very quick and efficient about that because we have a large pool of donors. And another phase is the recipient lining, which according to medical history is out from days to 20 days according to happen. The monitoring can be done through her country with our insurance, or she can come in Greece, days she can stay abroad. And then another is the transfer and the tests. So about 2 weeks from transfer to confirm the pregnancy. The timelines vary based on donor coordination, medical findings, and whether embryos are frozen for later transfer. Okay, so we can The most common question that we face is if the baby will the baby be genetically mine? This is the most frequent question. So the genetic materials we all know that comes from egg donor and sperm source, but the recipient is the one that is carrying the pregnancy, and she will give birth, and genetic and pregnancy related factors influence that development. Also, you can choose the donor characteristics. We guide matching based on program options and the regulations that we have. And also, I have also about how many embryos we can transfer. We can transfer or 2 per cycle, but sometimes 1 is indicated. After discussion and education, we will decide what's the best approach and for what specific medical reason to consider otherwise. And I would like to say, as a coordinator, our team will organize the plan, the schedule, the medication instruction, medication across the medical and team. I think I have covered the most of it. I don't know if you have any questions at this point. I think I talked too much. So I would happily answer your questions. Let's see from the chat. Great. Okay. Would you explain if or how much the child will gain trait recipient mother? Okay. So you're asking about what are the traits? Okay. This depends on the source of the egg and the sperm. Okay. And what traits will prevail? Okay. How much the child will gain. This is a question about the genetically. So I cannot cover fully that question about the gain traits. What is the cost of embryo donation in the clinic? The cost is 6,000 euro, including all the preparation of the donor, preparation counterpart. The tests are not included of the recipient, but all the donor part is included and embryo transfer in that 6,000 euro, the whole program. Medication are cheap in Greece. They are not so expensive, approximately 300 euros. Another cost you should consider is the freezing cost of the excess embryos. If from the fixed cycle we have excess embryos to freeze, those embryos will be freezed for future use, either for a second child or for a second try if the first one is not successful. So should we consider ask for when providing a profile to the clinic be matched with the donor? I'm sorry, let me read again. I cannot fully understand that. Should we consider for when providing a profile to the clinic to be matched? I'm sorry, can you clarify that question? I'm sorry, it's not quite clear what's been here. Okay. Other questions? So I would like to, as a closing, to say that donor egg IVF is a highly effective pathway for many patients when egg quality is the limiting. We as a clinic can focus on transparency, safety, and realistic expectations. We visualize medical care, strong coordination, so you always know the next step. Okay, so I have the next question. One moment. How often does it happen that couples starting with egg donation switch to an embryo donation, or after how many egg donation cycles would you recommend to change? And is that possible to your clinic? With egg donation. Okay, when we start with donation, usually it's not needed to change to the embryo donation. For example, when a recipient and the donor are synchronized, both of them, at least we can guarantee 2 embryos, okay, from this cycle. We may have more, but at least we guarantee 2 embryos. So the cycle from the beginning, it's a success. Okay. Do your clinics have a kind of psychological support during egg donation procedure, or what do you recommend to patient before starting that procedure? We don't have a psychological support, but this will be provided over your country with your doctors, stating that you are about, and you must have a strong family bond with the other members of family, or any other relatives or friends that have gone this. But we don't have a psychological support. As an IVF coordinator, what we can do, we have very effective communication. So before all this preparation and before deciding if you have second thoughts, we are here, happy to guide you step by step, and saying if you have second thoughts or something. So we can help with that. Okay, what things should we consider for when providing a profile to the clinic to be matched with a donor? The donor program in Greece, the egg donation is strictly anonymous. What you get to know is external characteristics, hobbies, profession, education, family known diseases. So this kind of information are known to you. Okay. And also, Greece is very close to many European countries, so it's very accessible. The prices are, we have good prices in contrast with other countries, so this is something to consider. Dr. Paraskos has 35 years of experience in the field. He's an IVF specialist, endoscopic surgeon. So all these aspects are very accessible. Okay, any other questions? Since we don't have question, we have a little time. I would like also to to stress at this point that all donors in Greece, according to Greek Ministry of IVF, they must successfully complete some tests to be eligible. So for egg donors are genetic and blood tests like cystic fibrosis, fragile X syndrome, karyotype, rhesus, sickle cell tests, infectious disease and immunological screening, general health assessment, is a vital screening protocol for the donors to be in Greece. So this is a transparent procedure for the egg donor screening. Okay, so that way we can prevent infectious disease transmission, genetic risks, ensuring psychological stability, accessing dedication and health to the donor. Okay. Seems no other questions. Thank you for having me. It was a pleasure. Will be at your disposal. Requests at our website. There's email, WhatsApp, Viber, any kind of communication. We will come back to you when for. Thank you so much for having me today. I'm wishing you all the best of outcomes on this journey.